Hi, Fred. First of all, thank you so much for taking the time for this interview. Um, and a very warm welcome to CHOSA. We are very happy to have you on board as a key opinion leader for CHOSA's cisplatin drug response predictor. And today we'll talk about the importance of a platinum predictor within the immuno-oncology products in lung cancer. But first, I would like to start by asking you to give a brief introduction about yourself and your impressive credentials in the work of helping lung cancer patients.
Thank you very much, Ida. And yeah, my introduction is I'm a medical oncologist, originally trained and educated in Denmark, Copenhagen, Denmark. I left Denmark in 2000 to United States, to University of Colorado in Denver, where I continued my work on lung cancer, particularly focusing on translational research in lung cancer, and was in Denver for 18 years. Among those years, I also, for many years, were the CEO of the World Lung Cancer Organization, the International Association for Study of Lung Cancer. In 2018, I was called upon by Mount Sinai in New York to build up a thoracic oncology center, and that is my function today. I'm a director at Mount Sinai in New York. I'm professor of medicine, and my role here is to build up lung cancer, multidisciplinary lung cancer program in New York. Lung cancer has been the focus of my work since my time as student in Copenhagen. And I have published more than 500 peer-reviewed publications on lung cancer, and also several books on the topic.
Thank you for that, and thank you for your impressive work and the important work you've been doing. So having many years of experience in lung cancer, could you explain to us the role of platinum-based chemotherapy in the treatment of lung cancer?
Certainly, platinum-based therapy has been the cornerstone of therapy for lung cancer over all the years. However, of course, more recently, during the last decade, targeted therapies have come into the scenario for certain defined subgroups of patients with lung cancer. And immunotherapy has also come in as a cornerstone of therapy for lung cancer. But for many patients, immunotherapy is still given together with platinum-based chemotherapy. So the platinum-based chemotherapy is still an essential part of the treatment for many patients with lung cancer, both non-small cell lung cancer and also for small cell lung cancer.
Okay, and what are the issues associated with the platinum-based therapies?
Well, issues for chemotherapy in general are, of course, for the patient significant. You have chemotherapy is associated to toxicity, and this type of toxicity is, of course, challenging for patients to go through, particularly we all know losing hair is a terrible thing. The cancer patients have to deal with when they get the chemotherapy, and also GI symptoms and many other symptoms, too many for mentioning in a short time. But chemotherapy is challenging for the patients. And of that reason, it is important to be able to select therapy which is effective and not expose patients to ineffective therapy, but only toxicity.
Yeah.
Patients are willing to accept toxicity as long as the treatment is effective. But it is a terrible situation to give ineffective therapy, but only toxicity. So if we can come up with a predictor which can predict who will benefit and who will not benefit, that will be an amazing achievement.
Yeah, so this is where the CHOSA's drug predictor comes in, drug response predictor. And yeah, but you mentioned a lot of issues with platinum-based therapies,
Yeah,
but why?
hematologic issues, of course, I didn't mention that, but that is significant.
Yeah,
Leukopenia, risk of infections, in many cases, severe infections, they are all coming with the chemotherapy treatment.
and so why are they still relevant? And do you think they will stay relevant in the future of lung cancer treatment?
Yeah, I do believe so. As I said, immunotherapy is rapidly developing, but in many cases, it needs to go together with chemotherapy as the landscape looks today. I don't know what the future will bring. I do believe that chemotherapy still will be highly relevant, either in combination with immunotherapy or after immunotherapy. Also, with targeted therapy, we see also studies with combination of targeted therapies and chemotherapy, although the landscape today point to if you have a targetable molecular alteration, most patients will receive targeted therapy as monotherapy, but there are coming more and more studies showing that adding chemotherapy to the targeted therapy or immunotherapy will increase the efficacy, also particularly related to CNS brain efficacy.
Okay, that's interesting. And now you already touched upon this, but could you please explain again the importance of biomarkers in oncology and how biomarkers for cisplatin, like CHOSA's drug response predictor, could be relevant?
In general, biomarkers are important when we are talking precision medicine. And again, as I mentioned before, it is important to select the right treatment to the right patient to ensure that we give the patients the best opportunity, meaning effective therapy with less toxicity. The terrible situation would be opposite, as I mentioned, where you only give toxicity but no efficacy. So selecting patients in general is significant, and we put a lot of effort into that type of development these days with predictive biomarkers. We are not successful in all cases, unfortunately, but there is a lot of effort going on. That has been my personal focus for many, many, many years in research. For chemotherapy, as we talked about, the toxicity is significant. So if we can come up with a predictor for who will benefit from chemotherapy, platinum-based chemotherapy, and who will not, that will be a huge achievement in the treatment landscape.
Yeah, I agree. And one last question. With your experience and extensive knowledge in lung cancer and biomarkers, how do you see the future of precision medicine shaping the treatment for lung cancer, particularly with the role of drug response predictors?
Yeah, I do believe there will be an increasing focus on predictive biomarkers to develop the right biomarkers. We are searching for the right biomarkers. We are not always so successful, but in many cases we are successful. And I think that is an important future perspective in treatment of patients with lung cancer, both non-small cell lung cancer as well as small cell lung cancer. We need to figure out how to select the right treatment to the right patients. So that is where the future goes. We are leaving the concept of one size fits all.
Okay, thank you so much for your answers and your insights. And again, welcome to CHOSA.
Thank you so much. It was a great pleasure. And let us do something good for the patients.
Yes.
That is important.
That's the most important thing.
Most important thing.
Yes.
Thank you very much.
Thank you.